right, so welcome back to the studio, and this is still morning, right? Tuesday's edition. Today is World Hand Hygiene Day. Yes, World Hand Hygiene Day, and joining me to talk about it, I have Dr. Edotoyin Eni, Assistant State Epidemiologist, State IPC Focal Person from the Delta State Ministry of Health. Welcome, Doc.
Thank you very much. Good morning, everyone.
Yes, and I also have Dr. Mercy Obi, Senior Medical Officer from the Delta State Ministry of Health. Welcome, Doc. Yes, all of us are. Is this like the official color? Is it blue? Oh, Delta State official color is actually blue. So we are repping Delta State today. So, Dr. Eni is synonymous with word like hygiene, hand hygiene especially. I remember in 2020, after the COVID, it started. You are a regular here. You've been teaching us how to wash our hands, how to to imbibe the culture of taking care of our hands, by way of especially the hygienic practices involved in washing of our hands. Now, some will say it's not just to use water and soap and just wash our hands. But Dr. Eni will tell you how many minutes you need to wait for when you squeeze, how you're supposed to squeeze it, the way that is appropriate. And that is why they are here to enlighten us, to remind us again, to give us that nudge that we need to really, really be conscious of our hygiene. Now, today is World Hand Hygiene Day. Talk to us why this day is in existence.
Okay, so thank you very much and good morning, everyone. So today is May 5th, and today has been set aside as World Hand Hygiene Day. And of course, World Hand Hygiene Day has a bit of history like everything. I mean, why today? So in 2009, WHO deemed it fit to carve out a day that we can use to create awareness, speak to people, remind them of the importance of this simple, cost-effective, but very effective. Even though it's cost-effective, people try to relate cheap with not being effective, but this is cost-effective and very effective in terms of preventing infection transmission. So in 2009, this day was marked so that every year we said to remind people that they should keep on washing their hands, because in the 17th century we have somebody that did something that made us know that washing hands is very important, and he was a doctor from Hungary. His name was Ignaz Semmelweis. Just to give us summary, he noticed that in the hospital where he used to work, that when women come to give birth, that if they give birth in a particular ward, they will die more than if they gave birth in a particular ward. And he noticed that those that died more in this other ward were handled by doctors, while those that the mortality rate was less in those that the nurses assisted to deliver their babies. So he was wondering, what is the problem? And he now noticed that the doctors will go and perform autopsy, from there enter with that hand to now assist deliveries, and then the women will now come down with complications and now die. So he now put a law in that hospital that before you assist any delivery, make sure you wash your hand with lime, which was what they used at that time. And when he did that, he noticed that the death rate drastically went very low, and of course he was celebrated as and then we did not really have so much of internet and so much, so he used his skills reduction and all that. And so because of that act, we're like, so see how important hand washing is. It's so important that it can prevent death. And so May 5th was earmarked as the day that we'll be celebrating and reminding and creating awareness on how important hand washing is.
Okay, let me come to Dr. Mercy. What is the primary goal for you of this celebration or observance, World Hand Hygiene Day?
Okay, thank you so much for that beautiful question. And it's very important because just like the public health physicians, we're after prevention, because prevention prevention is better than cure. From the prevention, we save a whole lot. So these hand hygiene practices will prevent us from so many diseases. Categorically, we have like about 6 of them. It will prevent like diarrhea diseases. It will prevent like respiratory diseases like the COVID, any other type of upper respiratory tract infections. It will equally help in preventing like some fecal oral transmitted diseases, hepatitis A, E. It can equally help in preventing some eye infections, like the conjunctivitis, and also skin infections, impetigo, all these bacterial skin infection. There's so many that this practice of consistently practicing hand hygiene can help us to prevent. Honestly, studies have shown that up to 30 to 50% of hand hygiene practices can reduce diarrhea diseases, and equally 20 to 25% it can reduce the upper respiratory infection. So consistently practicing this will save you cost. It will help you prevent all diseases.
All right, thank you so much, Dr. Mercy. Now, let's do the practical, because this is not theoretical at all. According to the health guidelines now, what is the minimum recommended time for washing your hands with soap and water?
Okay, so you know that thing that we usually do? See, and bring it out.
Yeah.
You have not done anything at all. So that's why we're using this platform. So if you're washing your hands with soap and water, you must make sure that you wash your hands for at least 40 to 60 seconds. And you know when you're washing, you may not be counting, but we advise that you sing the happy birthday song in your mind twice.
Oh, really?
So when you sing it in your mind twice, you know that you have adequately, washed your hand for the required amount of time. Because when we talk about hand washing, technique and timing is important. So if you're not washing your hand the right way, and you're not washing it for the right amount of time, brothers and sisters, brethren in the Lord.
I did, because I don't want us to do the happy birthday. We'll do it at the end of this interview. Because you practicalize how we're going to be singing happy birthday. Imagine, happy birthday of what songs?
No, what songs?
Okay, are there essential things that we need to, that is needed for effective hand washing? Do you think there are things that we need for effective hand washing?
Yes. Basically, we have types of hand washing. We do the normal soap with water, then we use the alcohol-based sanitizers. Okay. So when we do the normal hand washing with the soap and water, you have to be under a running tap, then you use a soap. Soap is very important to neutralize the dirt and reduce the growth of the bacteria on the hand and the surfaces. So then when we now do with hand sanitizer, which they've told us that it kills 99% of the germs of bacteria. So that's another type. So we need sanitizer when we do the hand sanitizer, the method in the hand rubbing using the sanitizer. And then we need clean water under a running tap. It's soap.
So what if there is no running water now?
Okay, yeah. It is already
because in this Nigeria now, to get water is even than getting running water.
Usually, we say if there's no running water, if you have maybe a Veronica bucket that has water.
Veronica.
That's okay, yeah. Okay. So you know that bucket with the tap, so it's named after the woman that discovered it. So you see, women are discovering things. So it's called Veronica bucket.
Okay.
So you just have water in the bucket where you thought, or you have somebody that can assist you to scoop water and pour it over your hands while you do the process.
That is like you must either you're using washing under a running water or under a Veronica bucket water, or somebody must pour the water on you. Wow, so we've been doing it wrongly all this while. Now, when should you use hand sanitizer instead of soap and water? Is there a particular time?
Yes. So for hand washing, we said 40 to 60 seconds. If you're using hand sanitizer, it's 20 to 30 seconds. And you use a hand sanitizer where your hands are not visibly soiled. So if probably you went to the farm, so you have some dirt on your hand and all that, if you use a hand sanitizer, it will not be effective for you. You must use soap and water. But if like now I've come to this amazing studio,
Right.
I've greeted my friends, I'm leaving, I bring out my hand sanitizer and I use it on my hand because my hands are not visibly soiled. I just greeted, I just touch surfaces. So you now use your hand sanitizer. So is when you need to use the hand sanitizer. But when it's visibly soiled, you dirt, probably you were sweeping, you were packing something and you have some debris on your hand and all that. So of course, you have to wash your hands with soap and water.
So is this true of us? You should always dry your hands after washing them to prevent the spread of germs. True of us.
So it's true.
So if I finish washing my hands, whether I am using the hand sanitizer or under a running water and soap, I must dry with a towel.
A towel, a disposable towel,
disposable
yes.
towel.
Disposable?
Yes.
I'll make this. Can you simplify this thing?
So what would be
like
by
somebody in the rural area,
area.
where would they get disposable
Yeah,
towels
so
from?
for those in the rural area, once you wash your hands, you allow it to air dry. If you do not, yes,
Dry.
to air
Yes,
dry.
I'll just like
No, once you're walking
you're
about,
walking,
it will definitely
So
dry.
see how we do it. So
Definitely
it's
not.
wrong.
No, you do know what your clothes are carrying.
Hey.
So, but if it's hand sanitizer, it dries very fast because it's alcohol. So
Oh, you don't
it's
need a
but
towel.
You don't
or
need.
hand
No,
disposable to clean with a hand sanitizer.
It does dries off.
So, but my fear now is because if you ask me, I think that getting a hand sanitizer, especially when my hands are not soiled, when I'm not cooking in the kitchen or packing dirt, I would prefer a hand sanitizer. But then, how will I know that I'm using a good and original hand sanitizer product? Yeah.
Okay, so if you get the hand sanitizer, the first thing to look at is the alcohol content in it. Is it up to
Sometimes they
70?
write it. and
Yes,
it's
so
not-
funny enough, I know we're in Nigeria. We should try and help ourselves though, because we know that some of the things that is written may not actually be what's in the product. Though.
Yes.
But people can make. So we have a guideline on how to make, if you want to make. But then the process of making, to mix all those things together. So we just buy and have faith that what is on the body is actually what is inside. So the alcohol content, at least 70%. It has a NAFDAC registration, and then, you see the company and like, okay, well, this company looks like a company that should be credible enough. Yeah. Because we have a lot of people making hand sanitizers. Even during COVID, we made hand sanitizers, at home. So far, you follow the guidelines. There are guidelines that are available, yes, on how to make it.
Okay, so now practical steps on how to wash our hands.
Yay.
Gang.
Okay, so World Hand Hygiene Day, and the theme, for this year is save lives, clean your hands. And then we have an action word, which is action saves lives, because we're tired of talking, people will hear, but the action is what we want to do. It's just like the Bible says that we should not only be hearers but the doers. So
But before you come to the sanitizer, I just remembered something. People like healthcare workers, that works in the hospital, most times they wear their hand gloves. In fact, if you're a patient in the hospital, you understand, a patient relation, if they want to touch your bed sheet, they will put on the hand glove. And I'm wondering, do they still need to do like the washing of hands after wearing the gloves?
So thank you so much
Yes.
for this question, because this is one of, part of what we want to do as to commemorate this day. We're actually going to go to our health facilities, and we are going to target those tertiary facilities that are major facilities that have a lot of influx of patients, have a lot of staff. So most of the people, they feel that once you wear gloves, you don't need hand hygiene, and that is number one false thought myth that we want to bust this morning. Before you wear your gloves, you must perform hand hygiene. Before. Then you wear your gloves. Once you remove them, you must perform. And then it's not all activities that you need to wear gloves. Not all activities. If you know you're not touching body fluids or performing aseptic procedures, you do not need to wear gloves. So there's something that we call rational use of gloves. You must assess the risk. These bed sheets that I'm carrying, is it stained? Is it well, the person that was lying was
Is
the person
patient-
vomiting,
is the patient
stooling.
HIV positive?
Because, you know, sometimes they just want to check, maybe, let me see
To
the drip
remove
flying, they are carrying a glove.
You know why? Because they're not the one buying it. So when
Oh.
you finish, your patient go
To
and
check
provide.
thermometer, temperature, put thermometer, they are wearing gloves. And then you can even harm yourselves more.
Oh,
Because
really?
when you wear gloves, you have this false sense of I've protected myself. Meanwhile, it just helped in, sometimes when they're even wearing the glove, when they finish touching all those things, they are picking their phone.
Yes, with the gloves.
Yes, so, or they are adjusting their belt or something. So you're even creating more harm.
Okay.
So you need to always wash your hands. Because if you wash your hand, attend, maybe do what you need to do, maybe examine. When you finish, you wash your hand. You've broken the chain of infection. You don't even have any fear. But if you were wearing gloves, you feel that you protected yourself, don't know that you just carried millions of bacteria back to wherever it is you're coming from.
Oh, okay, that's well noted. All right, so
Okay, so we have our hand sanitizer here, and remember we said that our hand sanitizer, if you're using it 20 to 30 seconds, so it's only when you're washing under running water with soap that you need to, 40 to 60 seconds, that is a happy birthday song that you're saying twice. So we are going to remind ourselves again of the steps.
Okay.
And we are saying that action is what saves lives. So
Action saves lives.
let's you know, keep up and take hold of this habit. So when we want to use a hand sanitizer, we try to get rid of all the jewelries on our hands, because they are also, you know, termites. Yes,
Really?
where microorganisms.
Including my rings?
Yes, where microorganisms
Wow.
can hide. So you will think that you washed your hand. Meanwhile, one microbacterium, one mighty thing is hiding somewhere. So you've seen that our hands are free and ready. Yes, you've seen he's doing well.
yes.
So we have our hand sanitizer. So we're all going to do it together.
Sure.
Yes. So I'm going to put a generous amount, about 3 to 5 mils. Yeah.
This one finished today.
About 3 to 5 mils. So you've seen us. Yes. There.
Okay.
So what we now do palm to palm. And we must know that we are trying to cover all the surfaces, and we are applying
pouring
enough friction
not too
as
much.
possible. So we now do this, open
But
your
my hand
hand,
is small.
and then you're trying to scrub in between, because these are one of the commonly forgotten places when you're washing your hand. Then whatever you do to this hand, so you're now coming to the back here.
Back.
Yes, so open your fingers, you're targeting in between the fingers. So the same thing for this hand, you're coming here. Okay, you're targeting in between, and I'm trying to scrub as I'm doing it.
Can you zoom in, please? So
Then the
Apply
knuckles,
pressure.
the knuckles.
yeah, great. If he's a master in this thing. So the same thing in this hand, come to this hand too, the same thing. So now at this point, I'm going to be laughing at Ify, because we are going to be doing the tip of our fingers.
Yeah.
And Ify knows why I'm laughing.
What? Oh, my nails! Oh.
Yeah, so if you
So
have
what
your lovely
happens?
nails, you cannot
Yeah.
effectively perform hand hygiene
So I
with
should
your
not be
nails.
fixing nails.
Yeah, so yeah, well, so I don't know if you're going to take that advice. So the tip of the finger, then you now have your thumb, another frequently forgotten
We're not singing
part.
the happy birthday now.
Yeah, so this is alcohol-based hand rub.
Oh,
And for this
okay.
now, if you need to sing, probably just once. After this, you now have your wrist. You see that it's already dry. Yep. So that is how to effectively.
We didn't sing happy birthday.
Yes. So
It's not
actually
necessary.
sing in your heart still.
In my heart.
Yes. You know, everybody wondering why is if you're always singing happy birthday song in the morning. So that's singing
Like
to
how
your
many
mind.
times? Like happy birthday.
Yeah, so
to you.
for this now you can sing once if you're using the
Happy
alcohol-based
birthday
hand
to you,
rub.
happy birthday to-
Happy birthday,
Happy
happy birthday to you.
And that's it.
That's
I'm
for
done.
this.
That's for that.
But if you're washing under running
running
water,
water.
yeah, so it's happy birthday to you, happy birthday to you, happy
And I'll be
birthday,
doing like
happy
this.
birthday, happy birthday to you, happy birthday to you, happy birthday to you. While you're going through the various steps, happy birthday to you.
That's it.
Exactly.
Then I will not clean my hands.
Yes, and if you have
Well,
that.
oh, thank you. We're going to practicalize. We're going to practicalize. I am my co-anchor.
Yes, so.
We'll do this. Let me know. I hope you're watching, because we're going to do this at the end of our program. Let's see if I'll get it. Thank you so much. We'll be
Thank
speaking
you.
with Dr. Idote Enyi, Assistant State Epidemiologist, State IPC focal person from the Delta State Ministry of Health. Thank you, Doctor.
Thank you
As
so
always. And Dr. Mercy Obi,
Yes.
right? Yes. She is a senior medical officer from the Delta State Ministry of Health. And I know there are activities lined up for today's.
Yes.
So maybe I think what the Ministry of Health should do, for instance, in DBS, give us the Veronica buckets.
Okay.
Like, not one, just let's position it. Yeah? Yes, now from the State Ministry of Health, say donated to DBS.
To DBS, yes.
Asaba. So we'll have it stationed at, so that when the running water is not there, we'll improvise and,
exactly.
you know, just wash our hands, because every hand needs to be clean, you know,
I like
as we're
that.
promoting hygiene. So
Yes.
we're waiting for you.
Okay, sure,
From the
definitely.
Ministry of Health. All right, thank you so much. We take a quick break, and please ensure that you wash your hands. If you're using running water and soap, sing happy birthday to you 2 times. And if you're using hand sanitizer, do it just once and you're done. We'll take a break. We'll be right back. Stay with us.